on environmental health issues and other topics. Today we have 3 speakers with us. The first is Carol Selman. She is the lead public health advisor with the Division of Emergency and Environmental Health Services for the National Center for Environmental Health at the U.S. Centers for Disease Control and Prevention. Sophia Walsh from the Cerro Gordo County in Iowa has agreed to give us a local perspective, and Kevin McCrae, who's the Chief Executive Officer for the National Groundwater Association, is going to give us perspective from the private side on private drinking water systems. Today's session is being sponsored in part by the National Conference of State Legislatures and is part of our effort to provide more information and services to the state legislative audience, both legislators and private or legislative staff. With that, I'd like to introduce our first speaker, which is Carol Selman from the Centers for Disease Control and Prevention. Carol?
Thank you, Doug. It's a pleasure to be with you. My presentation today is supported by Dr. Lorraine Backer. Lori provided some of the slides and background information. So let me get started here with the background. The Safe Drinking Water Act of 1974 ensures that most Americans are provided access to safe water. The Safe Drinking Water Act does not regulate drinking water systems that serve fewer than 25 people or have fewer than 15 connections. Most of these systems are private wells or unregulated small drinking water systems. Federally unregulated drinking water systems currently serve approximately 45 million Americans. Of course, some of these systems may be regulated at the state or local level. Next slide, please. Waterborne disease costs the U.S. more than $1.8 billion a year. There are approximately 578,000 U.S. underground storage tanks that store hazardous substances. 80% of recent tank failures affect groundwater. Compared to systems covered under the Safe Drinking Water Act, little is known about the location of these federally unregulated drinking water systems, the populations that are served, and the potential contaminants and other health risks that are related to federally unregulated drinking water systems. Small studies have found unsafe levels of contaminants in private wells, including radon, arsenic, nitrates, nitrites, and microbial pathogens. Next slide, please. 780 drinking water-associated disease outbreaks have been reported between 1971 and 2006. Of course, not all outbreaks are recognized, investigated, and ultimately reported, but this gives you an idea of the burden of the outbreaks that occur here in the U.S. And this slide also represents 2 multi-state outbreaks that were quite large. You can see those noted in the states that have a pentagon or a red triangle. Next slide. When we look at trends, it appears that the trend for outbreaks in federally unregulated drinking water systems is on the upward trend. Next slide, please. This slide depicts the key environmental public health functions in state health agencies. Environmental epi and food safety are the 2 most common functions in state agencies, but private water supply safety and groundwater protection make the top 10. Next slide, please. Key environmental health functions at the local public health level include groundwater and surface water protection and are among the top 5 services provided to communities. Next slide. Local public health functions also include regulation, inspection, or licensing services for septic tanks and private drinking water systems. Next slide, please. just as an example of the work that's involved in overseeing and preventing waterborne disease illness and ground and surface water contamination, we have an example here from Lincoln, the city of Lincoln and Lancaster County in Nebraska. And as you can see, they do a lot of work around permitting. They permit over 500 wells. They conduct over 700 well inspections and collect over 1,000 water samples. Next slide, please. NCEH's safe water activities include the private well initiative. The PWI is addressing many aspects of the public health impacts from drinking water from private wells and other sources not protected by the Safe Drinking Water Act, including by beginning to create a source that identifies and promotes access to data characterizing private wells and describing water quality, quantity, and quality in private wells and other federally unregulated drinking water systems. They're beginning to create and share an inventory of metadata on over 100 data sets with information about private wells and well water quality, and adding information from these systems on tribal lands. And they're also beginning to identify, evaluate, and recommend interventions to protect people from drinking contaminated water from federally unregulated drinking water systems. Next slide, please. Also, we're looking into contaminants in private well water, creating models to assess exposure to arsenic, uranium, and nitrates, assess the public health and economic burdens from cancer and cardiovascular disease associated with arsenic in private well water, and also in developing interventions to protect private well water quality. So we're looking to evaluate successive programs that are designed to educate private well owners and to identify and promote interventions to improve private well water quality. Next slide, please. NCEH'S, the National Center for Environmental Health, safe water activities also include a cooperative agreement called the Environmental Health Specialist Network, or EHS-Net for short. EHS-Net is a collaborative forum of environmental health specialists whose mission is to improve environmental health practice and identify and prevent environmental factors contributing to both foodborne and waterborne illness. EHS-Net works to identify environmental antecedents, and by that I mean the underlying factors to illness and disease outbreaks, to translate those findings into improved prevention efforts using a systems-based approach, offering training opportunities to current and future environmental health specialists, and strengthen the collaboration that's so important among epidemiology, laboratory, and environmental health programs. Next slide, please. This is an example of some of the awardees that are currently working on the EHS-Net, some of the EHS-Net water activities. It's Cerro Gordo County in Iowa. They and their partners are working to minimize the risk for arsenic exposure from wells. Minnesota is another participant in our EHS-Net program. They're looking at links between private well water and enteric illnesses such as Campylobacter, Cryptosporidium, and sugar toxin-producing E. coli. Tennessee is another example of an EHS-Net water state, and they are working on a comparison of land use, surface water, and socioeconomic status related to cryptosporidiosis. A project to map the location and water wells and on-site sewage systems is also underway there. Next slide, please. Here we have just a map depicting the states and local programs that are being supported by CDC, NCEH in a variety of different water activities, most of which I've very briefly described at a very high level. But as you can see, there's quite a diversity across the U.S., the diversity represented regionally, the Southeast, Northeast, Midwest, and the West. And the projects here are depicted as EHS-Net water projects and also other water projects that we are involved with. So, Doug, this is my final slide, and I believe you were going to take questions at the end.
That's correct, Carol. That's correct, Carol. We'll take questions at the end. And thank you very much for that presentation. I do want to remind everybody that that these slides do move forward a little bit slower than the speaker's request, and so if there is a small delay, please don't worry about it. The slide will come up. And I also want to make sure that everybody realizes that all these slides and these presentations are being recorded and that they will be available on the NCSL website for future downloads. The final thing I'd like to do is, if you do have a question for either Carol or Sophia or Kevin, please use the question tool that we have to submit the questions. That way we have them identified and collected, and we will try our best to make sure that all questions that are asked are answered. Our next speaker this morning is going to be Sophia Walsh. She is the Environmental Health Specialist at Cerro Gordo County Department of Public Health in Iowa, and she's going to give us a local perspective. Sophia?
Thank you, Doug, and thank you all for the opportunity to speak with you today. I grew up in rural Minnesota on a family farm that uses a private well, and my family mostly still uses private wells for their drinking water, so this issue is really important to me. Next slide, please. In Cerro Gordo County, about 15% of our residents use unregulated drinking water supplies, which is about the same percentage nationwide of folks that use unregulated drinking water supplies for their drinking water. Many don't know that this is their responsibility to maintain their water supply, since it's not a regulated water supply, and they assume that their water is safe. By definition, unregulated drinking water supplies are unregulated, and this means that no testing is done beyond the sampling during the final inspection right after the well is drilled. There's a great responsibility placed on the well owners to maintain their own safe water supplies for themselves and their families. In Cerro Gordo County, we have about 2,800 unregulated drinking water systems, and like I mentioned before, these are only tested immediately after they're drilled, which leaves about 1,500 sites that have never been tested. These were wells that were drilled before testing was required on new wells. So about half of our residents using unregulated drinking water supplies don't know if their water is safe to drink. And Cerro Gordo County is a bit of an anomaly. We're very fortunate in that we have the capacity to promote water testing and offer water testing as a free service. So our numbers are probably much higher than a majority of the nation and even in Iowa, since we're fortunate to offer those services. Next slide, please. So what I'm going to be going over today is just some common contaminants that are found in unregulated drinking water systems, coliform bacteria, nitrates, and some other localized contaminants such as arsenic, lead, radon. And to figure out what localized contaminants you might look for, it's best to contact your state or local health department, and they'll be able to suggest those other localized contaminants that you may want to be looking for in your well. It's really, really important to get your well tested as if it is unregulated, as you cannot see, smell, or taste contaminants that may be present in the well. And this testing should be done by a certified laboratory, and like I said, that's really the only way to know that your unregulated drinking water system is providing safe water. Next slide, please. So a little bit more about bacteria, or coliform bacteria specifically. Coliform bacteria is not usually found in groundwater. It enters from a surface source. So you may see coliform bacteria if there's a crack in the well casing or some other way for a contaminant to get into your water supply. Any present coliform bacteria is considered potentially hazardous. Coliform bacteria do include E. coli bacteria, and if you're not familiar with what E. coli bacteria is, it is bacteria that comes from human and animal fecal waste, so not something you're going to want in your drinking water supply, especially since some of the symptoms that it can cause are diarrhea, cramps, nausea, headaches, other nasty things, and it's really important that you don't get E. coli bacteria in your water supply, especially if you have young infants in the house, children, or people with severely compromised immune systems. Treatment for coliform bacteria, of course, meaning a properly sealed well, keeping sure that there's no way for this bacteria to get into your well, disinfecting the well when it tests positive for bacteria, and if there's a consistent issue with bacteria, using a chlorination or another disinfection system that consistently disinfects that well. Next slide, please. Nitrates are another common contaminant that we see in unregulated drinking water systems. Nitrates can get into your well from runoff from fertilizer use, leaking from septic tanks or sewage, as in the picture below, or even erosion from natural deposits. The Safe Drinking Water Act maximum contaminant level for municipal water supplies is nitrogen levels must be below 10 milligrams per liter. They're considered unsafe if they're equal to or above 10 milligrams per liter. And if they're above that 10 milligrams per liter, infants below the age of 6 months who drink the water could suffer from blue baby syndrome, and if left untreated, could die from that. And what happens with blue baby syndrome is the nitrogen is replacing the oxygen in the red blood cells, and that oxygen isn't able to be delivered to the organs that are necessary for that child to live. Treatment for nitrates, probably the best route to go is removing the source if possible. If the source is not able to be removed, using a reverse osmosis system will also work. Next slide, please. One of the more localized contaminants that I want to talk about, because it's a really big deal in Cerro Gordo County, is arsenic. Arsenic is often naturally present in the bedrock or soil. It can also be from runoff from certain industries. Arsenic has a maximum contaminant level for municipal water supplies from the Safe Drinking Water Act. Anything above 10 parts per billion is considered unsafe. And the health effects from arsenic include increased rates of cancer, neurological and cardiovascular, and skin problems, among many other issues. And we've actually had some residents come to us and talk about their issue with arsenic in their groundwater and share their stories. One in particular developed shaking and neurological problems, and later, after she went to her doctor, found out that their water had elevated levels of arsenic, and for her health, she was drinking the recommended 8 glasses of water a day from this well that had naturally occurring arsenic in it that was elevated. So what she was trying to do to be healthy was actually negatively affecting her health. Then once the doctor figured out that that was the issue, they took that away, and she started to use bottled water instead, and the symptoms decreased. And that really kicked off our partnership with CD, which eventually became a partnership with CDC, as Carol mentioned earlier. We're looking into arsenic in groundwater here, how it gets there, and what we found out so far is that it is naturally occurring, it's present in our bedrock, and now we're looking into why the arsenic is leaching from the bedrock and into the groundwater. And we're also figuring out recommendations to give our well drillers to how they can drill new wells that don't contain arsenic, if that's a possibility. Treatment for arsenic contaminated wells does include reverse osmosis, just like the nitrates, and distillation. Next slide, please. And I wanted to show this map that shows wells that had been tested for arsenic, which would be considered a localized contaminant. As you can tell, localized can mean different spots in the U.S. And here in Iowa, it doesn't show that we have much of an arsenic problem, but you can see kind of in the south in Iowa, there's less of an issue, but in the north, we need to test for it. Next slide, please. Other potential contaminants, certainly other parts of the U.S. Each specific area deals with their own issues with their water supply, and it's going to be really important to check with the state or local health department to determine what those potential contaminants may be. They could be naturally occurring. They could come from a chemical or hazardous spill. You hear about those in the news sometimes, or from an industry source. Next slide, please. And before I wrap up, I wanted just to give some recommendations for unregulated drinking water supply users. What we tell our residents to do is to properly maintain their wells and other parts of their unregulated drinking water system. Make sure there's no cracks, make sure it's all sealed up so that nothing can get into your drinking water supply. Test your unregulated drinking water supply at least once per year, and that would be for bacteria and nitrates, and we also suggest arsenic here, but like I said, any other localized contaminant that might be pertinent to that situation, or more often, more than once a year if the water quality changes. And then finally, if your water test is unsafe, even though it's not required to, we do recommend that you follow our recommendations to get that water treated or begin to use a different source for your drinking water. And next slide, please. And as my final slide, I just wanted to give some resources that have really good information about contaminants in private wells, or excuse me, unregulated drinking water supplies, and that those are places you can go for more information. All right, thank you.
Thank you very much, Sophia. Again, I'd like to remind everybody, if you do have a question, please submit the questions for answering via the question tool on your screen. And finally, to get a private sector point of view, we've asked Kevin McCrae, Chief Executive Officer with the National Groundwater Association, and he is also the Chief Executive Officer for the National Groundwater Research and Educational Foundation. So with that, I'd like to turn it over to Mr. McCrae. Kevin?
Thank you. NGWA, as we call ourselves, and it's more than 11,000 members, certainly want to thank our colleagues at the National Conference of State Legislatures for the opportunity to elaborate on this topic and actually reinforce some of the things you've heard from the first two presenters. Our membership includes scientists, engineers, construction and service professionals, equipment manufacturers, and distributors who are all committed to furthering groundwater awareness and protection through education and outreach. As a membership organization, we're also dedicated to advancing the expertise of all groundwater professionals. It's our intention to be a leader in promoting the responsible development, use, management, and protection of the groundwater resource, and really no matter how those resources are applied, be it for drinking water or irrigation or some other purpose. Next slide, please. Out of an estimated annual withdrawal of about 79.6 billion gallons per day of groundwater for multiple purposes, groundwater withdrawal for domestic supplies are about 3.7 billion gallons per day, or less than 5% of our national withdrawals. Although it is estimated those withdrawals are nearly 98% of the private water supply to households, the others being some of the other means that were elaborated on before, including hauled water or some other system of supply. In all, these households are estimated to be about 13.2 million occupied households, and they're serving about 41.9 million citizens. Slide, please. Natural water quality varies a lot, and it's often on a well-by-well basis. Concentrations of substances can vary substantially over short distances and with depth within aquifers being the reservoir that holds groundwater in the subsurface. Well owners should understand that wells may obtain water from different aquifers with very different water quality than samples others may have taken or recorded. Because of the three-dimensional nature of groundwater, aquifers can be stacked on top of each other. Well owners who often do not have records on their well's depth can check with state or local regulatory agencies. These agencies may have information on groundwater conditions at a finer resolution than what a homeowner's understanding may actually encompass. Private well owners can greatly reduce risk to their water supplies through proper well location and construction, regular well maintenance, regular water testing and treatment, and of course groundwater protection. That's been our message for many years, and as you've heard today, it's the advice shared by many, both public and private. The fact is private well owners can do a great deal to reduce risk to their water supply in order to have a high degree of confidence in the quality of their water. It's really not terribly complicated. Slide. There are 4 basic steps. It begins with proper location and construction of the well to minimize the potential for contamination. Proximity to a contamination source and the integrity of well construction can be factors in whether or not a well is susceptible to contamination. It is critical that we all continue to remind the 13.2 million households served by private wells to keep these systems in good working order. Our advice has long provided these tips. If a consumer has not recently tested their water quality, their first step should be to check if the well is clean and then test for a constituent of local concern, both naturally occurring and man-made. If consumers also have a treatment device, they should follow the manufacturer's recommendations for maintenance and to include routine testing to check the treatment performance. If constituents are found at levels above health concerns, then of course consumers should talk with their local water well or water treatment professional or a local health official about the options they may have. Slide. Effective well construction standards and qualified water systems professionals protect consumers and groundwater. 48 states license water well construction and service professionals through competency testing, many including mandatory continuing education for that license renewal. We kind of set the stage for this back in 1970 when the association developed a voluntary certification program for water well contractors and pump installers. As with the state governments, the NGWA program also requires mandatory continuing education for certification renewal. 16 states today use our certification exams as part of their state water well professional licensing program. Statewide water well construction standards are enforced in 47 states. And local standards exist in some areas where there are no statewide codes, and in some instances, statewide codes are supplemented with special construction standards in limited aquifers or limited geographic areas where naturally occurring or man-made constituents occur above established public health benchmarks. In compliance with the expectations of the American National Standards Institute, or ANSI, NGWA-led efforts are currently underway to update industry standards for water well construction. ANSI, as you may know, is widely recognized as an independent body that certifies such practices and standards for a multitude of professions. And upon request, I'll be happy to provide a summary of the many laws and programs in place to support proper well construction and qualified groundwater professionals. Slide. Additional thoughts is that there are means by which the gaps can be filled if a state doesn't have a program. There's ways to ensure if there's adequate funding for inspections and enforcement. These are kind of the challenges as well that are out there. And review state standards against industry standards. And that's part of what we try to do in partnership with our regulatory officials across the United States. Slide. Regular well maintenance is vital to safeguarding the integrity of existing water well systems against potential contamination. This includes checking the well casing above and below the ground, various sanitary seals including the well cover or cap, and other vital well components. Regular well maintenance also includes servicing any water treatment equipment according to the manufacturer's recommendations. Slide. As owners of private residences have a personal accountability to make certain their furnace, their fireplace, water heater, smoke detector, and other systems are in good working order, private well owners also maintain the primary accountability about their residential well system and the water it supplies. Slide. Regular water testing and treatment, if necessary, are important responsibilities of the private well owner. Many public and private organizations recommend substantially the same thing as we've heard today. Well owners do find government and private sector guidance for when and where to get their water tested and for help in interpreting their results. Slide. A qualified water well system professional should determine if the well is clean in order to obtain an accurate sample of the groundwater. If the well is dirty, it should be first cleansed by a qualified professional. Slide. Next, well owners should test annually for bacteria, nitrates, and anything of local concern, or more frequently if certain symptoms indicate a need. Testing leads to consumer assurance about their water. Research has shown that if consumers are aware of water quality problems, they will take action to correct the problem. Consult with appropriate local authorities about what those constituents might be of local concern in the groundwater, as you've heard from our presenter just before me. Slide. If water quality is of concern, in almost every instance, it can be treated effectively with appropriately selected, installed, and maintained technology. Should any constituents above levels of health concern remain after proper maintenance, it does not mean the well owner cannot use the groundwater. If after proper well maintenance and cleaning, testing reveals materials above levels of health concern established by regulatory authority, consumers should talk to a qualified water system professional and/or a water treatment professional about options such as rehabilitating the existing well, installing a new well, or installing appropriate water treatment technology. Water treatment devices are available to treat most water quality issues. A qualified water well system professional or qualified water treatment service provider can advise the well owner on how to proceed. Slide, please. When considering a water treatment device, the well owner should be sure its specifications match up to the substances and concentrations they wish to treat. Also, there are performance testing programs for treatment systems, such as those of the Water Quality Association and NSF International and others. A professional should evaluate if the technology being provided to the consumer has been voluntarily submitted for performance testing. When considering a water treatment device, it's our judgment that it's important that the technology be properly selected to match the material of concern and the concentration levels, including checking if the technology has been performance tested. The water quality testing being done should be done following initial installation to confirm expected system operation, and ongoing qualified maintenance should be undertaken, including periodic water quality testing. Slide. Among the supports in place in this area are NSF International standards for testing and performance of point of use and point of entry treatment devices. NSF and other labs test these treatment devices against standards and provide a listing service that consumers and professionals alike can access. The Water Quality Association operates a voluntary certification program for treatment professionals, much like we do for water well system professionals. And our organization has developed a number of what we call best suggested practices to identify strategies for groundwater professionals, water well contractors, drillers, pump installers, and others, to use to address problematic constituents that may occur in groundwater. Several of these best suggested practices are in place for many of the common naturally occurring constituents considered as potential human health risks, including those that have been mentioned in the previous presentations. Slide. A qualified drinking water testing lab should be used, and the lab or a local public health authority should review the results to determine whether a health risk exists. Among the qualified water testing sources are state-certified drinking water laboratories. States do certify these labs for testing under the Safe Drinking Water Act. These labs may also offer services to private well owners. The Safe Drinking Water Act standards used for community water systems can provide private well owners with a benchmark against which to compare constituents in their drinking water. These standards are typically used by labs when providing results of water testing of private wells. Slide. At the time of initial well construction, 19 states require testing of private domestic wells, but financial lenders may also have requirements, and that's another outlet for increasing consumer confidence. We advise our member professionals to inform their customers if certain naturally occurring constituents may be locally present and to stress to the consumer the importance of water testing prior to use. The association standard form business contract voluntarily used by the industry includes appropriate sections for these purposes. And at times of property transfer from one owner to another, private domestic water well systems are required to be tested as part of the Veterans Administration loan process. The Federal Housing Administration loan process identifies specific triggers when water testing is required. And at the state level, several states such as New Jersey and Rhode Island and Oregon have specific laws addressing private domestic well testing and property transfer. Additionally, there are numerous state disclosure laws that require the seller to disclose to the buyer known materials defects that could affect the house. And like I said, private sector lenders may also require water testing as part of the loan application process. Slide. And that's our friends at our colleagues at the CDC have been involved in a number of things, including, as we heard in the previous presentation, supporting the state groundwater quality. And there are other efforts underway with the other federal agencies, such as the U.S. Geological Survey, to do more to ascertain water quality, groundwater quality, and level monitoring networks as well. Slide. Again, one of the best ways a private well owner can reduce risk to their drinking water is to protect the groundwater from the risks of contamination. As you heard in the previous talk, and I'll just elaborate on this a little bit, start by locating any abandoned wells on their property that could serve as a direct pathway for contamination into an aquifer. And of course, these should be decommissioned by a qualified water well system professional. Well owners with septic or other on-site wastewater recycling systems should have those systems also checked by a qualified wastewater system professional. A failing wastewater system may present a contamination threat to the groundwater. Third, properly use, store, and dispose of hazardous household substances, which may include, but aren't necessarily limited to, gasoline, paints and thinner, fertilizers, weed killers, pesticides, and cleaning products and other things. Slide, please. And then we'll go on to the next slide. The federal government has also some limited programs available that may offer financial assistance if treatment devices or a new or rehabilitated well is needed. The Federal Rural Housing Administration's 504 program has low-interest loans available to very low-income households. And some of these funds have been made use for residential water well systems. Grants are available in some cases for those residents 62 or older. There are grants available through the Federal Rural Utility Service Household Water Well Financing Program that can be used to help capitalize revolving loan funds through partnerships with not-for-profit organizations. And the intent there is to help low to moderate income households with affordable payments. As I said before, the CDC supports, slide please, supports state and local health agencies in identifying local water quality issues. There is an effort underway to create a national or broader national groundwater level and quality network. And the U.S. EPA offers technical assistance to well owners as well, and we're a grant recipient of some work for that agency at this time. Slide. The Veterans Administration, as I already mentioned, has a property loan process, and the FHA as well has a property loan process that identifies certain things. Next slide. Although we're organized to be a membership association of groundwater professionals, we do take on important roles in conveying important messages about groundwater safety, protection, and sound water well system construction and maintenance. We speak directly to consumers through our self-funded consumer information service www.wellowner.org. It's been visited more than 1 million times since its inception in 2005, and it's always highly ranked on Google when the search term is water well. A new feature there is a set of fundamental and straightforward instructional courses on various aspects of private well stewardship that a well owner can complete without cost. And we also operate a toll-free consumer hotline at 855-420-9355. Slides. And consumers can also download from our site a number of free tip sheets on how to keep their groundwater and their well safe for their use. And we partner with more than 100 agencies and 8 associations each year for National Groundwater Awareness Week and Protect Your Groundwater Day, both that have an aim towards good groundwater and water well stewardship. Slide. We have an extensive array of programming aimed at creating better water well system professionals to assist in delivery and protection of groundwater. Slide. So again, the 4 basic steps to reduce risk from things in groundwater that may not be good for human health if they're in the wrong concentrations. They are simply proper well location and construction, well maintenance by a competent professional, testing and treatment of the water if needed, and finally, groundwater protection. And I'll conclude with our final slide, and thank you for the opportunity to take part today.
Thank you very much, Kevin. I appreciate your comments there. Again, I'd like to put forward that if you have a question, please post it on our question tool using the GoToWebinar system. We do have a few questions, and I'd like to bring that forth to the entire panelists. But the first question comes in probably most directed towards Carol, which is, what are the dangers from crypto and some of these other diseases, waterborne diseases that we do find in our drinking water systems?
Well, crypto is a parasite, and for groundwater systems, it would be we would be most concerned with contamination of groundwater from surface water. It's definitely not a very pleasant bug to have. And can be difficult to get rid of. So, you know, basically, some of these other things that you don't really hear about in terms of well water are things that you should be aware of. It's not just things like E. coli, which is bad enough if it's the wrong kind. But some of these other things that are kind of, you don't usually think about, like parasites being in your water system.
Can these bugs and these diseases, can they easily be killed by chlorine?
Chlorine is certainly one way that is used to treat water systems, and very successfully so.
But is there an easy fix by just adding chlorine to the water?
This is Kevin.
Yes, Kevin.
Please go ahead.
Carol, Kevin?
All right, I'll go ahead.
Kevin.
Chlorine can be a very effective disinfectant. There's no question about it. The problem that we often encounter is that it is too easily applied. Too many people have this belief that a little bit is good, so a lot must make a big difference. Actually, a lot of advice is given to consumers to apply bleach to their well system, which we do not advise, because the bleach can actually be damaging to not only the components within the well system, but can actually exacerbate some of the biological conditions that may be present in the well. That's why we really emphasize the importance of proper well cleaning before we get involved in applying an effective disinfection or some other treatment technology.
And that segues into the next question for Kevin. What are some of the recommended treatment options that a private well water user can use? Is there a an attachment they can put on? Is there a chemical can they add in, or is it a little bit more complicated?
Actually, it's a good question, and it reinforces the message I was trying to deliver, and that is it's critical to select a treatment methodology that's appropriate to not only the constituent in question, but the levels at which the constituent is there. So what we may select, let's say, for nitrate may not also be the appropriate solution for arsenic. Or what we may select for fluoride may not be the appropriate treatment technology for some other contamination concern if it's at a level above a recommended public health standard. So the critical thing is to have your water tested to know what you're actually looking at and at what levels, and then to work with a qualified professional to select the right technology. Obviously, we're all consumers, and we're exposed to treatment technologies, but we have to be cautious that we're really picking the best solution for the problem that we have at our property.
Thank you very much, Kevin. The next question comes for Sophie. Is it common for counties to commonly test, or is Cerro Gordo a unique situation, at least for the state of Iowa?
So in the state of Iowa, we actually have a grant program that allows each county individually, health department, to have a certain amount of money to specifically do water testing for private well or unregulated drinking water supplies for the residents within their county. And I do believe that Iowa is a fairly unique situation. But as far as what I have experienced in the rest of the Midwest, the health department or the state hygienic labs or even some of the private labs are very good places to go to get your private well tested, and do offer that water testing at a fairly reasonable cost, probably between $15 and $30 for a bacteria and nitrates test, which really isn't too bad.
And the next question kind of follows up with that, and this goes out to all the speakers. So in essence, there is not a national requirement to test these wells, and it's broken down by state, and even the private sector gets involved. But essentially, we can see several wells out there that may have no testing or no remediation done to them at all. Is that correct?
Well, probably so. I don't think this is Kevin McCrae from National Groundwater. It's probably so. But not to diminish the point, there's probably a lot of systems in households that aren't properly tested and maintained. That's why it's so important for the CDC and county health departments and associations like ours and the many partners that we have in Awareness Week and Protect Your Groundwater Day that we continuously work to convey to those 42 million Americans living in 13.2 million households with private wells that they have a responsibility to maintain that system for their own self-interest and their health and the health of anybody that visits their property. But, you know, not every well has a problem, but in order to be confident of that, that's why we recommend what we do, the regular annual testing and the proper maintenance and the proper protection around the wellhead.
And then the follow-up question to Carol. So this is essentially a state and local responsibility. It is not the responsibility of the CDC to make sure these private systems are regulated.
That's correct. That's correct. It's a state and local. As far as regulation is concerned, CDC doesn't regulate. It's a state and local function, and there are other certainly federal agencies that would be involved from a federal level. But for these private well systems, it's strictly a state and local oversight responsibility. CDC is concerned about the some of the consequences of utilizing these unregulated drinking water systems. And when I say unregulated, I don't just mean federally, but also the state and the local, because of these health issues that can be quite serious. So everything from the arsenic in water to cryptosporidiosis, these things are quite damaging to those that are exposed to those kinds of contaminants. So we are quite concerned about it, and that's why we're working with our state and local agencies to support them in conducting projects that can help them better understand the systems, what's going on in their particular state and local areas, and also how to educate those well owners in what they can do. And as Kevin says, they are ultimately responsible in terms of their own personal private well system. But the important thing is that they truly understand their system and what the characteristics are in their particular community, and what the dangers are of not being mindful of how to keep their wells protected from surface water.
And we have a follow-up question, Carol. The chart you provided listing the outbreaks, did that cover every waterborne disease outbreak from private wells, or was that just a sampling of the results?
Well, remember that at CDC, we can only report on those outbreaks that are reported to us. So these are outbreaks that we know about. It's certainly not all of them.
So they're not all of them, but it's a good sampling out there about what we're seeing in the nation as a whole. Is that correct?
That's correct.
And I'm going to turn this next question probably more over to Kevin. But what impact does private septic systems have on private well waters? And do confined animal feeding operations, have you seen much of an impact there?
Okay, taking on-site wastewater and septic systems first, just like with well technology and fireplaces and furnaces and smoke detectors, requires a level of responsibility by the property owner to make sure that system is properly located, installed, and maintained. But certainly, water wells, private water wells, and on-site wastewater systems can coexist, and they do, but they have to be maintained and properly sited. That's where public health officials work with that industry to make sure that happens. As far as concentrated animal feeding operations, we actually organized, I think, the first national conference on that topic about 10 years ago, maybe even longer. So we are aware of it. And yes, again, if those systems are not constructed or sited correctly, constructed correctly, and maintained correctly, there is a risk of them producing runoff usually from the surface, as we heard, and create a potential threat to groundwater supplies on a localized basis. Again, we put all these systems out there in our society. We have to make sure that they work well together, and that can happen through doing those proper steps that are essential.
And we have one final question that probably can go out to the entire group, but does it make sense for people who use the water just for drinking or cooking? Does it make more sense for them to use bottled water, or is the private system safe enough? Is our water supply from the private system fairly safe overall?
You know what, this is Carol. I would think that if someone has an underlying health issue, or and they have some concern, if they talk to their doctor, it's kind of like the example that I think Sophie gave, but if they talk to their healthcare provider, and if that's what they recommend, then so be it. But it does not mean that private water wells cannot be safe. You just have to be mindful of what it means to maintain it properly and test properly.
Okay, thank you. Well, with that, on behalf of the National Conference of State Legislatures, I want to thank our three speakers today, and for everybody who participated in the call. As we had mentioned, this webinar will be posted on our website, and people will be able to download the slides and and hear the audio from this session. In finalizing this whole discussion, I want to again thank Carol Selman from the CDC, from Sophia Walsh from Cerro Gordo County, and Kevin McCrae from the National Groundwater Association for speaking with us today on this very important subject matter. So with that, I'd like to give everyone a good afternoon. Thank you.
Thank you.